Hi, my name is Allie Walter. I am a registered nurse and I am going to be a pediatric nurse practitioner. I am originally from Vero Beach, Florida. I have now been in Nashville for a little over 3 years. I have been working at the Children's Hospital at Vanderbilt for those 3 years. A lot of times I do help with some preoperative things, so consent, education, etc., etc. I am typically taking care of patients in the recovery phase after surgery. So I am the face that they see when they wake up. I help educate parents on post-operative care and what it looks like to go home for them, or if the patient is staying in the hospital, I then report to the nurses upstairs. My job involves a lot of education. I have to educate. My other job is that I work at Lipscomb University as an open lab instructor. I teach the nursing students there. I graduated from Florida State University in 2017. In order to pay for school, I relied on a few scholarships, but also a number of loans. At the time, I was expecting to have some help paying off those loans. However, due to some unforeseen circumstances, I am now responsible for all of that debt. If it had not been for my student loans, I may have gone to grad school sooner. However, as it stands now, I am applying to grad school. My husband and I plan to pay for that out of pocket. I am applying to programs to hopefully graduate with my Master's of Science in Nursing to become a dual certified pediatric nurse practitioner. Dual certified meaning I hope to work in both acute and primary care. I think nursing specifically offers a unique perspective on patient care. I love being an advocate for patients, specifically in pediatrics, because I can be a voice for their cry. For my patients, I hope that as their nurse, I can make their environment a little less scary while they're in the hospital. If I've done that, then I know I've done a good job. On a larger scale, I would hope to inspire and educate the future nurses and new nurses to the nursing community. On my old unit, I helped start a mentorship committee, and that got me really passionate about mental health within healthcare, specifically for healthcare providers. I think that our healthcare system really needs nurses, and it's important that we keep the nurses that we have. I hope that I am practicing as a nurse practitioner. I really love cystic fibrosis patients, and I love neonatal abstinence syndrome patients as well. I think the opioid crisis, specifically in Tennessee, is a problem that we need to pay attention to. I hope to be in more of an educational role. I have a lot of professors from Florida State that I really look up to, and they helped inspire me, so I hope to do the same for future nurses. 15 years. How old will I be then? I mean, I hope I continue to educate and work as an NP. Maybe even further pursuing my doctorate, or maybe participating in research about cystic fibrosis or neonatal abstinence syndrome. I don't know that it's really that surprising. My parents would say that they knew I was going to be in healthcare when I dissected a rat in middle school and came home and just couldn't stop talking about it. I don't. But I love Earl Grey black tea. It really depends on my mood. Going to work, the Schuyler sisters from the Hamilton musical work. Just feeling like a good day, wanting to dance. Finesse by Bruno Mars. Something my counselor has taught me is treat yourself like you would want your best friend to treat you. I strive to do that for the people in my life and for myself, because I can best take care of other people when I'm taken care of. I love dogs. We've now fostered 7. This is Winona. She's our current foster dog. We are going to adopt her when she's medically cleared, but she's kind of been my patient at home, which is really fun.